Good morning, everyone. I thought I'd pop in and say hi while I've got a few minutes. I've got a training session shortly, which is why I look a bit like I've been dragged through a hedge backwards. But I thought I would come and say hi and just do a quick update on something I've been wanting to talk about, something I want to do a blog on. I'm just trying to check I am all good and live and see if anybody makes any comments. So it looks like we're there. I hope you've had a lovely weekend and that you're raring to go. It's actually quite sunny here this morning. I've just been down. Those of you who don't know me, I keep bees, and I've just been down in the sunshine with my coffee, just to go and say hi to the bees and make sure they're right. I upset them yesterday because I had to poke them about a bit and take their lid off, and they don't like it when it's starting to get cold. So the thing I want to talk to you about today, excuse me, is expectation management. And it is a really, really important part of what I do. Now, it's one thing having somebody come in and having a skin tag taken off, which I can say, it's quite small, it'll feel a bit sore for a day or two, should go, but if I'm taking off a big lesion, they have to understand that the healing process can sometimes take a few weeks, whereas a skin tag's really quick, and there's a little dot and that might go very, very quickly. And so it's managing expectations between the healing process of the two, the likelihood of scarring, and those kind of things. But more specifically, aesthetics is very much a wide and varied arena. The results vary between people. People vary. So what I do looks different on one person than on another. And it's really, really important that I make sure that people know exactly what to expect. And sometimes we don't know what to expect, so we have to do a bit of a wait and see, and that they know what the process entails and what we hope to see, what to do if we don't see what we expect, and those kind of things. One of the most sort of specific of these that I'm thinking of is filler. Now, I don't just mean sort of having your lips done and things like that. What I'm talking about is the more sort of full face. Sorry, I've got something in my eye. It's more the full face, anti-aging, trying to lift and sort of do this and plump up and replace lost volume and things like that, because everybody responds slightly differently. What they're expecting to see varies, and actually what I'm looking at on somebody might be very different to what they see in the mirror. The approach that I generally tend to take with volume replacement fillers and anti-aging fillers is kind of slowly and steadily. I don't like particularly doing sort of lots of syringes all in one go. I have done as many as 8 in one sitting. I don't particularly like doing that. It's a lot for the person to sit through. And we don't know how their face is going to adjust around those fillers. So for me, I would prefer to do an area and do maximum 2 to 3 syringes in one sitting. So if I'm doing the perioral region, for example, we might put one in for lower face support. We might put one through the upper part of the lip for the sort of smoker's lines, the sort of creases here, and another one into the lips, into the oral commissures, maybe a little bit into the sort of dip of the jowl here. See how that settles. It might be enough that the person goes, actually, the things that I was looking at that I thought I wanted everything doing, actually, that's taken enough away that when I look in the mirror, I don't go, oh dear God, what am I looking at? So then we can assess and go, okay, how are we looking? Because it might be that it's taken your eye off the thing that's bothering you. It might be that you can see the improvement and now want to do the next thing, rather than sit there and have 8 syringes all in one go and perhaps not even recognize yourself very much because it's a lot of change in one go. This gives your brain a chance to adjust to the changes. It gives other people time to adjust. And the fewer you do in one go, the less likely other people are to notice. So it might be that then we come in with a couple of syringes for medial cheek, maybe a bit through the cheekbones, maybe a little bit here. I'm not a huge fan of starting with nasolabial folds because to me that's a symptom, not a cause. So the cause of increased nasolabial folds are often mid-face volume loss. So you lose more volume here, the face drops, you get deep creases here. So you put this back in, not only do you get support of the under eye, it lifts this here a little bit, and then you need less filler in this part. So mid-face is really good. So you might do 2 syringes there, possibly 3, because you might put some into the lateral face, which can help put some volume back in and help lift a little bit. It's about putting coat hangers back in. So, you know, that's in total, we've talked about 6 syringes of filler there. Would we do all that in one go? I would very much prefer not to. You can do temples and some into the forehead, because as we age, we lose. I most recent filler I had was into the temples, and if this starts to dip in, it's very aging. The sort of tail of the brow, my eyebrows need doing. Tori, I need you. My brows need doing. The tail of the brow starts to drop into the dip. It causes this to drop down. So filler into the temples can help lift as well. But again, I wouldn't do it all in one go. I was recently in a position where I had someone, and maybe I didn't discuss the expectation management as well as I could have. I think people, and this isn't meant to be patronising, people hear what they want to hear, and they're fixated on a thing. And I say, okay, yeah, we should be able to get you there. And my job is to explain that that's going to happen in stages. It's not going to be magically transformed. This isn't a facelift. You know, these are slow, steady improvements. It might involve skin treatments. It might involve anti-wrinkle injections and those kind of things. And we created a staged approach for somebody and we started with replacing mid-face filler. She'd lost quite a lot of weight and felt that she looked a bit gaunt. And we chose an area to start. It doesn't really matter where you start, but it tends to give it's 1 syringe, it tends to be relatively untraumatic, so it's a nice one to start with some people. When she came in for review, I took some photographs, and I was very happy with the clinical result of replacing her mid-face volume. She was concerned that she looked more gaunt here, and I think what happened, she had some volume here, and it highlighted the rest of the face that she still wanted to replace volume in, which makes complete sense. And I would say it's a bit like decorating your lounge and realizing your hallway needs doing. Do you know what I mean? It's that progression. You do one thing, we need to focus on the next thing. Now, it wasn't a surprise to me that had happened. We had talked about more of a full face approach, but we'd started slowly, and she was surprised to see that, I think. So that falls to me. My job is to make sure she knows, look, we're going to do this one. It might highlight the other things more. And so it became apparent to me, and it made me realise I needed to address this more. Maybe I need to address this more in my consultations, and make sure that everybody is aware what we're planning, where this is going to go, you know, what to expect, what not to expect. And frankly, 1 syringe of filler is not going to give you volume in your face. You know, 1 syringe the syringe that I use are 1.2 millilitres. That is 1/4 of a teaspoon of filler. It is not going to make a dramatic difference to the face. 4, 5, 6 syringes over time, yeah, absolutely, you're going to see changes. But again, hopefully in a slow, structured, subtle way that are going to make sure that person is happy, that their face adjusts nicely around it, that other people aren't going to notice too much. So it's about making sure everyone understands the plan. If someone comes in for skin treatments on their face, if you book one of our memberships that has ongoing treatments, you're not going to look like a different person 3 months later. But what is going to happen is over the course of a year, your skin health will improve, it will be brighter, lines may be softened, and this is ongoing. It isn't a course of microneedling is going to transform you. It will improve things, and you may notice a significant difference. If you do that course of 3 microneedlings and never do anything again, in 12 months, 18 months time, you're going to feel like you're starting again. So my job is to make sure you understand how this works. Make sure that you understand that a course of microneedling is a really fabulous thing. Microneedling is great. The results are clinically excellent. But if we don't then do anything else, if we don't address your skincare, if we don't put in a plan of treatments over time, whether that's more needling, whether it's chemical peels, they don't have to be weekly. These can be monthly, 3 monthly, and that's what our memberships are set up to do. But if we completely stop doing anything, the results will fade with time. So while you might get long-term results with things like scar revision, because they're not coming back in the way that wrinkles will come back, lesions that we remove, some can recur actually, but they're easier to keep an eye on. But with aging, it is an ongoing process. With volume replacement, 1 syringe isn't going to do your lips, your cheeks, your chin. And it's my job to make sure you understand that. This is why we introduced our memberships in the first place, because we understand that ongoing skin health is a process and it is ongoing. You can't just stop. And if you do, you can't expect the results to stay forever. You will have improved skin for a while, but life, the aging process, stopping using actives in your skincare will all start to make a difference to your skin over time. So for me, expectation management is really, really important. And it's my job to make sure you understand that. And I'm going to put this in a blog because I think people need to see it and understand that if you're fixated on a thing, my job is to make sure you understand how much of that thing we can improve, how long it's going to take, and if it's going to stay fixed once we get there. It's very easy to think that, and this is, like I said, this isn't meant to be unkind. This is how we are as humans. We go, right, I want the thing. How many times have you bought a thing thinking it's going to transform your life? The new notepad is going to be the thing that changes my life. But unless I use the notepad, it's not going to change my life. And it probably won't change it that much, but it might make me a little bit more organised. And it's the same with this. One thing isn't going to transform your life. One skincare product isn't going to transform your life, but it might start to make a difference. And if we add that into a process and we understand exactly, what we're trying to achieve, then you will see a difference. Trust me, and hopefully listen to what I'm trying to explain. And my job is to make sure you understand what that process is. So if you are interested in memberships, skincare, fillers, whatever it is, the consultation is part of that. It's quite comprehensive. It can take at least half an hour. We make good coffee, come and have a chat, and we can sort out all of the things that we need to do so we can make sure you get the results you want, you're happy, and you understand what that process is. Understanding of expectations is half of the result. So that's really, really important. If you don't feel like I've explained it properly, I need to know. So that's really important. That's all I wanted to say this morning. Have a lovely day. Enjoy your Monday. If there is a glimmer of sunshine, it's gone again now, but if there is a glimmer of sunshine, go and get it. Pull your sleeves up. That's what I just did. I went down to see my bees, got some sun on my arms. It's really important for your vitamin D and for your general health, your circadian rhythms, all of that. Really, really important. Then get your SPF on for the rest of the day. And I will catch up with you later. See you later. Have a good day.